Get ready for Tagged Beyond the Award, a podcast produced by the Abley Group.
Welcome back to Tagged Beyond the Award. My name is Justin Starbird, and today I get to welcome BJ Mack, the Senior Director of Healthcare Solutions for Enovis. BJ, man, great to see you. Welcome to the show.
So great to be here with you. It's good to kind of connect the dots between TAG Awards and talking in person. So excited about the chance to visit.
It is pretty cool. You guys are part of the inaugural Tag Awards program for MedTech. Couldn't be more happy and excited to welcome you to the family and recognize you for all of your innovation. First of all, congratulations on all of your success so far.
Appreciate that. Yeah, it's always great to have a chance to see the industry recognize a lot of the hard work that goes on behind the scenes. And, it's always nice just to be able to, we people like to say award-winning whatever services or whatever, but to be able to actually show, yeah, we are award-winning and with something that aligns so well with our values as a company with what the TAG Award represents is really a nice little mesh point.
Yeah, no, absolutely. It was really exciting to learn more about the organization and what you guys do. Talk a little bit about Enovis and what it is that you do.
Yeah, so Enovis is a new umbrella name for a very old company. Enovis is was born about 3 years ago, I think. But it replaced an umbrella name of DJO. And if we rewind the clock even more, DonJoy was our one of our first company names, brands, if you will. We are an orthopedic company focused on MedTech for products and services. But we also are going into areas that are beyond a little bit of the traditional orthopedic space. We are a company that has some roots with some other life science companies, and Danaher maybe would be a name there. But if you look at the brand names that we have in our portfolio, DonJoy, Aircast, DJO Surgical, Chattanooga, Dr. Comfort, there's a full array of products that we manufacture in the orthopedic space. But due to technology and innovation, we've really had to open up our portfolio even more. The division I'm with is called Healthcare Solutions, and we are focused on software and consultative services to help orthopedic practices, hospitals, IDNs do the business
Mhm.
of DME or orthopedics even better. So there's just a lot of history, rich history. I mean, our first knee braces were cut out of neoprene rubber by ex-NFL players in California in the 70s. And so to be able to go from that to where we are today, but to continue to maintain the legacy of patient care and all the focus that goes into that is really a fun journey.
Oh, man, I bet your day seems like no two ever look the same, huh?
Oh, for sure. And the orthopedic space, I mean, is rapidly changing. I mean, just, recent news that we're relaying to our customers about, competitive bid for DME or, the ASC changes for our surgical division. There's just an awful lot to keep up with. But that kind of goes in line with, some of our uh, key behaviors and our values of, continuous improvement. We just always that's at the forefront of what we want to do to be able to drive home the fact we got to always keep getting better, but we
Yeah.
can only do that if we're doing it together. And that's our big company tagline is creating better together. So it's fun to be able to look at in the orthopedic industry. We can touch a patient from beginning
Mhm.
to during surgery to after surgery. And that's very unique in the
Yeah,
way that we can help a practice be almost a one-stop shop in certain cases.
that's pretty neat. Tell me a little bit about, you're the Senior Director of Healthcare Solutions. What does that actually entail? What do you oversee for Enovis?
Uh,
Enovis.
Cat rodeo person, maybe. No, there's a there it's a fun role because we get to go in, and I come from a clinical background myself as an AT and working in orthopedic offices in my past lives. But to be able to go in and look, I identify with the problem that you're having, and I love the name of our division, Healthcare Solutions. We're going to provide solutions for a lot of the problems that these practices and IDNs are seeing today.
Mhm.
But from that role, we've got a team of our healthcare solutions team has about 50 something people on it, and we've got everything from an in-house automation development, uh, architecture on the website, technology, and all that stuff. Um, all the way over to true consultants that go in and help implement our software or teach a clinic how to do the business better. And then the consultative piece of keeping up with the latest and greatest in our orthopedic world as a sales and consultation team. The software that the TAG Award did recognize to be able to help automate a lot of the very laborious tasks in an orthopedic office is under that's one of the roles that I have is to help promote and sell that software too.
Yeah. Well, so that's the MotionMD is what Enovis won for, and it was nominated in the healthcare category. So, it was really neat to see not just the fact that you're able to help with automated workflows, like you said, there are a lot of tasks that are not super exciting in those offices, and so for you to be able to do that, it also creates transparency for the patients. Talk a
Mhm.
little bit about its genesis. How, as somebody that had a knee injury in college while playing football, I was thankful that it was no longer the rubber neoprene rubber that you had, and
Right.
that you continue to iterate and on the technology side, software and what you guys have come up with, you seem to follow that same approach. So how did it begin and get to where we are today?
Yeah, great question. So, if you're watching a college NFL, basketball game, whatever it is, and you see an athlete wearing a brace on their knee, like you had, or whatever else, or if you're walking in the airport and see someone in a walking boot or whatever else. So, yeah, we're going to manufacture that product and sell it or get it to the patient, but there's a very complicated world from an insurance perspective here in the States about what all goes on behind that transaction. Everything from proper documentation to the right coding to the right reimbursement amounts being set, and it's very complex the way the healthcare is set up in the States for these items.
Yeah.
We saw as a manufacturer that a lot of physicians didn't want to mess with all the hoops to jump through. They just wanted to get their patient a brace. So about 30 years ago, we developed an arm of our company where we would manufacture it, but we would handle all the billing that went into it, all the inventory, all the stuff there, so that the physician could just focus in on getting the device or the product to the patient. So we now in our space bill, if not the most, we're right up there at the top with in the country with billing insurances for these braces. So long story short, we needed something to help us manage our own business. And
Yeah.
so paper is a high PHI risk, as we all know. It's very cumbersome. It takes a lot of time, and there's a lot of steps that go into it. Plus, we also found that a lot of physicians' offices we're also deciding, you know what, we want to actually capture some revenue off of this and be a provider ourselves. But there's a lot of fraud out there.
Yeah.
If you rewind a couple years ago, if you look in a magazine or a late night infomercial, does your back hurt? You can get a free brace, or all those things that were. There's a lot of fraud that was happening out there. So regulations have really stepped things up. So if you add the complexities to everything that I just talked about, automation was a need. So we decided we needed something for ourselves. So we built a system called MotionMD, helped it manage our business a little bit. And then we started licensing it out to other clinics to be able to use on their own. Now it's a full-blown inventory management system. One of the key hallmarks of it is a tool called VeraPro. You use the word transparency there. That's a hot buzzword right now in coming out of Washington, D.C. for healthcare is price transparency. Well, several years ago, we wanted to be ahead of that curve. And so we developed a tool that's inside of MotionMD called VeraPro. The number one question patients ask when they're handed a brace, I don't know if this has happened with in your scenario, but can tell you the number one questions asked is patients are going, am I going to have to pay for that brace when they're about to be handed it?
Yeah.
And before VeraPro, nobody could give a good answer. It was always, well, we'll bill you later. Just wear it and we'll send you a bill later.
You get used to it, feel
Yeah,
better, and then
it'll be
and then
fine.
we'll tell you maybe how much it's gonna cost.
Yeah, and it's really absurd if you pull back and go, that's how we do business. So
I
we
think
built some
I've
technology.
heard other people describe it, less a little more colorfully.
We'll leave that to the imagination, right? But what we did though is we're going to solve that problem. I go back to solutions and problems. Um, we built a tool called the VeraPro component of MotionMD, where it checks the patient's insurance, their deductible, their out of pocket, their co-insurance real time and matches it up against what the contracted rate is by payer so that by clicking a button, you are now able to do two very important things. One, tell the patient exactly what they owe.
Mhm.
You've got this much remaining on your deductible. This is what the insurance is contracted to pay us for. So you're providing that price transparency, which is a huge thing today. The second thing that you're able to do with that is collect the cash up front.
Mhm.
Statistically, for the durable medical equipment world, which we're talking about right now, um, patient responsibility for these devices is about a third. It's a little actually over a third. And so if a clinic is just hoping to get paid by the insurance and be fine, they're leaving a third of the dollar on the table if they're not getting that from the patient up front. Patients are consumers today. That's a big shift that we've seen in the healthcare world. They have high deductible plans. They are shopping around like they would for anything else for the best care. They are consumers. And so they're expecting to have to pay is the psychology that we see today. So the VeraPro tool, the technology, and we've got a bunch of other innovations inside of MotionMD. But that's one of the key things that we are really proud of. And we're grateful for TAG recognizing that for that award.
Yeah, how do you guys go about, challenging yourselves to commercialize these new products? Not just on the, DME side, but this is a technology that you now are sharing and licensing with clinics to participate in that, additional funding that you're talking about. How do you continue to challenge yourselves and stay true to the history of the company as well?
Yeah, great question. Because of the name brand reputation that our brands have, the Donjoy and the surgical, and now with a brand new foot and ankle line, we're kind of continuing in that vein as well. We are very involved with the customer at the customer level, from VOC conversations to key opinion leaders to educational events. We're always wanting to know what are you dealing with that is hard today? What if you had a magic wish here, what would you wish for? And to be able to take that input, and especially from our Motion and D perspective, if they're like, hey, it would be great if there was a button that did this. We've got such a robust sprint cycle that we can turn that stuff around really quick because everything's in-house for us
Yep.
to be able to stay true to those values of listening to the customer and identifying the problems. But again, I go back to our dual role as a manufacturer and as a biller. What we see on our end as issues, we want to make sure that we're addressing ourselves. So we've got a dual path to listen to what the needs are in the space, in the medtech space. So that's from a technology perspective. From a product perspective, we've got a very in each division, they've got a very robust marketing team that is always looking at what the next best thing is,
Yeah.
from a coding perspective to a patient comfort perspective. We recognize that technology has to play a role in what products are being developed. But what we really believe is that if we can go alongside and help the customer with a problem to solve their problems, the product sales will come
Yeah.
because of the trust gained there from helping them with an issue. One big thing that we're constantly seeing, and you referenced it earlier, was some of the boring, mundane tasks, and staffing is a big problem in healthcare today.
Yeah.
We could have a whole other podcast on that one, but if we're able to actually help someone with their time, like you could be freed up to go do something else because of all the workflow automations and whatnot. We've just provided something super valuable to that customer.
Oh, yeah.
Product will come later.
Yeah. What is so thinking about the platform itself, I mean, it definitely seems from the information I was able to see, and of course I'm not by any means running a practice, but what are some of the ways in which you are helping, give them those solutions? So you mentioned the time, what is the setup like? Is it
Mm.
easy? And then is it easy to push out those new updates, and does everybody benefit when you do that?
Oh, that's good. Yeah. So to be able to take a very cumbersome paper process and, depending on the clinic, let's say it was from the time the physician or the provider says, put this brace on the patient to the time they walk out the door. If that's a 10-step process, we'll call it analog versus a digital process, we're cutting that at half.
Mhm.
We're making the steps easier, not only on the front end but the back end. So, for instance, when the patient signs that they're getting, and then they're required to sign that they're getting it because it's a prescribed product. Um, Now, from an inventory perspective, that's automatically decremented out of the inventory upon patient signature. Someone doesn't have to go back and go, well, what did we dispense today? Count it up, and now this is what we got to order. There's already a reorder process started on the backside. So we're actually working on saving those steps, both in the office and and look at something that people don't think a lot of in this space is how quickly can we turn that room over? So if you think about an orthopedic visit, patient comes in, they sit in the waiting room, they get called back for X-ray. They're sitting in X-ray waiting room. They get their X-ray, they go into a room, wait on the physician to come in, um, comes in, diagnoses, whatever. Now they're waiting in a lot of cases for that brace to come to them. 15 minutes because of a paper process versus if we can do that quicker, now that room gets turned over, you've saved 10, gone
Yeah.
from 15 down to 5. If you do that 4 times a day, you've opened up more slots in your schedule. So we're always looking at the efficiencies to be gained in the workflow. So the technology allows us to do that. We integrate we've got integrations with over 70 EHR, EMR, PM, various third-party groups to be able to save the steps of, well, do I need to type this in or whatever?
Mhm.
Let's hit the easy button, as the old Staples commercial would say. That's where we're always looking for the easy button on
Yeah.
that.
So I love that you bring up Staples. It's very much a direct consumer brand, right? How is this different than, say, a traditional SaaS platform that is, maybe, like Salesforce or something that's more for the masses? Who are the users of the platform of Motion MD, and how do you adjust
Mm.
what you're building versus making it just aesthetically pleasing?
That's a great question. So we've got a couple different markets that are actually using the MotionMD platform. That could be an orthopedic clinic,
Yeah.
a single group, or part of a large group, which we're seeing a lot of consolidation these days, and that'll be something we can talk about in a second. But we've also got third-party groups that are They're not a manufacturer, but they are suppliers of all that. They recognize the value of the inventory management and the integration for that. Hospitals, IDNs, and the ED or the urgent care centers are using this as well. Podiatry groups are using it because when you talk about with one transaction, with one what we call patient agreement form, you're working on the inventory, you're working on the compliance, you're working on the price transparency, and you're working on the overall profitability of the DME program, depending on who's billing for it. So one system is actually tying it all together, and it's a really key thing. In a lot of these offices and settings that I just described, you might have someone that's dealing with the inventory and then someone who's dealing with the billing or someone who's dealing with the documentation or whatever, and it's all siloed. And nobody in a big in any healthcare, I mean, removing silos is the buzzword, right? If the right hand knows what the left hand's doing, fewer mistakes are made, things are billed more properly on the front end. I mean, depending on the range, there's a really interesting stat that shows that I mean, a third of everything that's submitted in healthcare, there's going to be a denial, right?
Mm.
And so, how can you reduce the denial on the front end? Yeah, granted, you're going to have to go back and work things because things just don't always work, and you got to appeal and all that stuff. But if you're actually doing it right on the front end, so you don't have to go back and do that, now you're saving time, and time is money.
Yeah. Oh, right. That's going to be a huge time opportunity there, especially if you can make that process, easier. That's
Yeah.
incredible.
And
So, oh, go ahead.
and telling the clinician, the workflow person, this is not ready for billing yet. You forgot this. There's some intuitive things built in that are going to say you need this. This code may not work. Don't forget that you have to do this. And again, that goes back to doing it right. Like your dad always said, do it right the first time, so you don't have to go back and do it again on the second time. That really does play into this, and the time and money thing really plays into it as well.
Yeah, absolutely. So you mentioned as well, you have a lot of stuff in-house. Like how do you, get this out there? I mean, yes, you've got incredible brand recognition for your devices and, the hardware. Thinking about you as a software company as well, that must be a little bit tricky when you're talking about competing with,
Mm.
organizations that's all that they do. But that's all they do. However, they don't have the knowledge and industry expertise that you do to make sure that it's, to your point, intuitive as well. How do you tell that story?
That's a great question. We actually have a bunch of different ways that we get the story out from the standpoint of a local bracing rep going in and talking to the clinic and it looked like you're having trouble with this. What if we were able to help that, right?
Mhm.
Um, People on my team where they're actually meeting with customers at the business level, physicians and providers will always be the way that this business goes around. Without them, we can't do anything. But if we talk about healthcare consolidation and bigger entities involved, um, all too often the physicians may be a little left out of the decision-making process when it comes to some of these products. That's just the nature of it, would be it private equity or MSOs or whatever else. So healthcare solutions, we make a point to really go talk to the administrators, the CEOs, the CFOs about that, to be able to drive that point home and talk to them about the problems and how it translates. Um, Educational events that we put on, be it running webinars or in-person meetings with administrators and DME coordinators to be able to tell them about the latest and greatest. Because remember, we're not only doing it for their perspective, we've got to know ourselves as a biller. And so whatever we learn, we're sharing with them
Yeah.
as well. So that allows us to be the leading voice out there, and they're now listening to, okay, well, what do you got that's new on the technology side? They're always wanting to know what's new and what's coming, and so that's fun to be able to be that resource for our customers.
Yeah, that's a lot better than having to go in there and sell them and introduce them to stuff. So that's a great
Yep.
spot to be.
Yeah, it sure is. Sure is.
So thinking about Enovis and what else you guys are doing, talk a little bit about what's on the horizon. I mean, yes, you just won the award, and we're so happy to have you, as I mentioned before, as one of our inaugural winners. But this wasn't by happenstance. You guys have put in the work. There's been a lot of effort. You have an incredible team. How has this galvanized that team? How has it helped them? Feel about, going to work every day.
It's good. Everybody, no matter how, behind the scenes or humble or whatever they are, truly, and I mean that there are a lot of good people out there that do that. Everyone needs a little bit of pep in their step with attaboy or attagirl, right? We all need that. And to be able to have a little bit that not only, look, sometimes social media and the marketing world today, you got to brag about yourself a little bit. And so to be able to post, a LinkedIn or an X post or whatever it might be that, hey, we won this tag award. I mean, it's due to all the work that you guys did. Look at this. And the best part about it is how that translates over to the customer. So the customer says, hey, that sounds like something I'd like to dig into and look at a little bit because of this award-winning thing, right?
Yeah.
So we go talk to the customer, we get them set up, and they love it, and they're giving us their compliments or whatever. To be able to go back to the development team and all the behind the scenes people and say, hey, look what you're doing. You're actually making a difference with these testimonials and whatnot. All that does is just spur on, okay, we're going to keep getting better. Speaks to our value of continuous improvement. We we always want to keep getting better. And that rings true with, I mean, we are an acquisition company right now, growth. We're in a high growth mode. We I mentioned our foot and ankle division for hardware and the pieces that go into a lot of the complexities of the foot and the ankle. We have built from scratch through via acquisitions and mergers our own foot and ankle division.
Mhm.
And so we're continuing to look out for what's next on the horizon, not only from new products. Our Chattanooga line has really made and we call that our recovery team from one of our divisions. They have done a lot of innovation with laser therapy, the light therapy. Even it even goes beyond humans, right? We've got a division of that is providing those services to cats and dogs and vets for the laser and the light therapy. So there's a lot more to come with our company from not only going out and developing new products, but also acquiring new things. So we're in a high growth mode, but it really goes back to what we're doing, what our values are to take care of the customer, to take care of the patient, actually make an impact there. That's just spurring on more and more. And the award makes it a little bit easier to say, all right, what's next?
Oh, well, it sounds like there should be more entries in the near future as well. So that's really exciting.
Yeah.
Well, BJ, I really appreciate you taking the time today to share more about what's really behind the award and behind MotionMD and Enovis and what it is that you guys are doing. It's really neat.
Well, it's great. I'm very grateful for the opportunity to do that. And I don't just say that, I do mean it because we do need things like this to help spread the word. It's always nice to have other people talk about you as opposed to always talking about yourself. So that's what I'm grateful for right now.
Awesome. Well, I really appreciate you coming on the show and look forward to, continuing to watch you guys grow, innovate, and see what is next.
All right. Well, thanks. We'll talk again, hopefully in the future.
Absolutely. Well, you've been listening to the latest episode of Tagged Beyond the Award. On behalf of my guest today, BJ Mack, the Senior Director of Healthcare Solutions for Enovis. Until next time.